The East Injury Prevention Committee wishes to present a brief tutorial on what we do and why. A lot of it comes down to determining the difference between accidents that cannot be prevented and questionable life choices that absolutely can. Looking at CDC data, unintentional injury deaths remain a significant portion of deaths throughout various age groups, as do violence-related injuries. We're going to go through a few key topics. First being overdose. The dissemination of Narcan into the pre-hospital setting has done an amazing job reducing opiate-related deaths. Geriatric falls remain a significant portion of what we see. I'd refer people to the East evidence-based recommendations for prevention of fall-related injuries in the elderly, which include reduction of frailty and environmental changes. Within the pediatric population, drowning remains a key issue. This has gotten better, however, with advocacy of building fences around pools and having mandates for life jackets. A big win within the injury prevention community has been reduction in traffic deaths. You can see reduction of deaths relative to vehicle miles driven has gone down significantly over time. A lot of this has to do with design changes within the vehicle itself as well as public health education. This is in stark contrast to our failure to reduce firearm-related deaths over the same time period. And a lot of this has to do with lack of federal funding for gun violence-related research. Recall that the majority of firearm-related deaths are actually related to suicides and not homicides. This has to do with the lethality of the method. There's a lot that has been done and still needs to be done to reduce firearm-related suicides. Beyond that, the American College of Surgeons has put forth its Gun Safety and Your Health brochure, which tackles key topics to reduction of firearm-related injuries. I'd also refer people to this article from the iSafe group, which gives great attention to social determinants of health and what we need to do within our communities. So in the end, injury prevention comes down to see something, say something, do something, get involved in research, advocate for our patients, and then put injury prevention methods out into your practice.